Hi, everyone, and welcome to the very first episode of the Detox Talks podcast, brought to you by Doctor Morse's Healing Herbs. In addition to our monthly webinars, we wanted to get a dialogue going based on our monthly body system and tackle some of the most common questions we get from our customers about each system.
Yep, so this month we're focusing on the respiratory system, and we'll be covering everything from herbal inhalants to shortness of breath. We'll discuss how Dr. Morse's formulas can be paired to support common respiratory imbalances and end with a craniosacral massage meditation for respiratory health.
That's right. Lots of good stuff coming up. We have over 20 years of collective experience working with Dr. Morse's formulas and practicing herbalism. I'm Colleen, and Jenn is my co-host. We love getting to spend time spreading the good word about some of the most powerful detox formulas and protocols on the planet.
So now we can get started and explore how you can support your respiratory health with the help of our herbs and protocols.
Awesome. All right, let's get started. Question 1.
All right. So what is the difference between 3-herb blend and lung detox? Yeah, we get that question a lot. When should you use either one? So aside from the obvious herbal structure, the 3-herb blend is a good formula to start with. It's just like the 3-herb tea as far as ingredients. And you can always follow the 3-herb blend with the lung detox formula. But the lung detox provides a deeper cleanse, you could say, helping to break up some mucus within the lungs and just support the overall health of the lung tissue. So if you're not familiar or used to the herbs, I would say start with the 3-herb blend or the 3-herb tea, and then you can progress to the lung detox. But if you're familiar with it or you have some very, very chronic standing issues with your lungs, might as well get right into the lung detox. But you can alternate them.
I love lung detox.
Yeah.
It's such a tasty formula. My kid loves lung detox. We get the glycerin for her, and that's like her little medicine bottle
like
that
3,
she just
isn't it? Isn't she?
She's 3, yeah. Yeah, so 3 lung herb is just that. There's 3 herbs in it. There is mullein in it, mullein, fenugreek, and pleurisy.
Yes.
And so mullein and fenugreek are, mullein, I call it a mucomodulator because it's really good at kind of regulating the mucus of the lung. And also fenugreek, we know from you can make it as a cold infusion. It makes a good mucusy water. So kind of like flax or chia, fenugreek is great for that. And then pleurisy is actually named after a type of lung imbalance, which is called, how is it pronounced, Jenn?
The pleura. Pleura. Yeah.
Pleura, which
pleura,
we don't hear that often anymore. The lung pleura.
But yeah, if you have a respiratory illness, you probably have heard your respiratory therapist or doctor mention it a lot.
Yes. So, and it's an imbalance that impairs the lubrication function, essentially, of the pleura. And so pleurisy is a more warming and cooling herb, and it's also an antispasmodic. But you can imagine when your lungs might be spasming. Yeah. And so that would be a good time for this pleurisy herb. So you've got these 3 herbs. They're helping to keep the lungs moist and regulate moisture in the lungs. So if you have too much moisture, they'll help balance that out. And they also help with that antispasmodic piece. So it's just a really simple formula with 3 herbs that's just really good for supporting lung health long term. I really like it just kind of as a daily tonic tea. And then the lung detox, as Jenn said, is deeper working formula. It's got L-campaign in it. It's got both mucolytics and expectorants. And we'll actually talk more about that in a little bit, like what the difference is between those. So stay tuned for that. But yeah, it's a tasty formula, especially as a glycerate.
Yep.
And it does that deeper work. Absolutely. And that makes me think about how we're not really taking the time in this podcast to do an actual anatomy and physiology of the lungs. But one thing I will say is the lungs are actually very wet. And, for a long time in my life before I studied A&P, I thought they were just these empty balloon sacs, but they're actually very full.
Well, that's what they lead you to believe. So
that's what they lead you to believe. But they're incredible. They're actually quite dense with tissue, and they have, the passageways that the air flows in, and then a very thin single cell lining of the lung, much like the gut, and much like just kind of all the tissues of the body. They're absorbing that oxygen that we breathe in, and they're also one of our big detox organs that we don't think about much because we are expelling carbon dioxide all the time. Mm-hmm. And also it's a huge evaporation machine where we're evaporating off a bunch of potential excess fluid in the body through the lungs. So the lungs work in tandem with the kidney to regulate the fluid in the blood and therefore blood pressure. So if they're not functioning properly, you could see that they could lead to other imbalances that you see with kidney dysregulation and whatnot. So getting the lungs on board and taking a tonic formula like Lung Detox or 3-herb blend is a really nice way to kind of tonify that system and allow it to work properly. So let's go on to the next question. So can you take both Lung Detox and 3-herb blend together?
Okay, so I would say more the tea and the tincture, the 3-herb tea along with the tincture rather than the Lung Detox and the 3-herb blend tincture. I just prefer to take the tinctures, separately, get the full benefit because the tea is pretty versatile. We'll talk about making an herbal, steam inhalant in a moment. And just you can sip the tea throughout the day. And it is very, very soothing too, because I recently had to do such a thing. But then, the tincture, has its cleansing benefits. So, for me, I'd say do a tea and a tincture combo rather than both tinctures together.
Yeah, and I know, Jen, you do the same where when we're talking about someone's health and they have lung issues, we definitely will throw both of these formulas at them simultaneously. And because, we want to hit it with all the herbs and we want them to be really focusing in and narrowing down on those lung supportive herbs. And so that leads me to this conversation about solubility, which is like one of my favorite things to talk about. And so why would you do the tea of the 3 lung blend with the tincture of the detox blend? It's because these herbs that are in the 3 lung tea are really good when infused into water. So you've probably seen me on the webinars talk about this before, how you have these wonderful phytochemicals in some of these herbs called mucopolysaccharides. Remember those, Jen?
Mm-hmm. I do. Yep, that's a mouthful.
So mullein, it's a mouthful. So mullein and fenugreek both have those mucopolysaccharides. So that's 2 of the 3 ingredients in 3 lung tea are best infused into water. Not only water, but cold water is the best for extracting those mucopolysaccharides. So you would actually follow the instructions on the tea bag, which is to simmer the tea for a little while with the lid on. You don't also want to lose the volatile oil, so you want to keep the lid on your tea as you're steeping it. So simmer that for somewhere between, 5 to 10 minutes, and then actually put that in the fridge overnight, ideally, if you can, and let that do a cold infusion with the herbs still in the water. Then when you strain it out in the morning to drink it, it's made the water a little bit thick and kind of let's call it snotty, or I like to use the word mucilaginous. And
totally.
That's mimicking, think about that. That's mimicking a healthy lung, right? You want your lungs to have a healthy coating of that mucilage in order for them to function properly so that they're only evaporating out the appropriate amount of water with each breath, right? So that they're retaining a lot of moisture, and a lot of imbalances of the lungs come from those from that mucus lining drying out. And if you have too much congestion and you have too much kind of buildup in mucus in the lungs, you might not want to do the cold infusion. You might want to just steep and simmer the herbs and drink them hot, because that heat is actually going to really help break up excess mucus. Regardless, the mucopolysaccharides are really good regulators. Like I said, mucomodulators, so they aren't necessarily bad for like thickness in the lungs. And then you've got the pleurisy, which is more drying and cooling, so that kind of helps to counterbalance those.
Now that we know how to do the infusion, it just kind of sounded like you're getting pretty close to a herbal tea gummy if you leave it in there pretty long. Like that,
that would take a lot of tea, but yeah.
Thought of an herbal gummy bear,
Oh, yeah. Well, there's ways to do that with both gelatin and also there's a couple of vegan options as well. I think the best one that people like to use is agar, but you could absolutely make this into an herbal tea, a strong herbal tea, and then add a little honey and agar and make yourself some vegan gummies. I love that.
Now that we talked about the herbal infusion, the solubility, so how about an herbal inhalant? What do you recommend, like as far as garden herbs that you could work with in an inhalant?
Yeah, Dr. Morse has been talking about herbal inhalants for a long time. We actually have a whole PDF on that Jen will get into in a minute. But as an herbalist, I say one of the go-tos for supporting the lungs is to do herbal inhalants. And this is as simple as what volatile herbs are growing near you, right? So Go into your backyard, take a walk in your neighborhood, look for rosemary and lavender. And let's see, I love cistus. If you don't know what that is, rock rose. It's a very common landscaping herb. Yarrow and eucalyptus. So what's growing near you that has a really strong aroma that smells pleasant? And you just gather a bunch of those in a basket and take them in the house. You get a big bowl and you start boiling some water. You put all those herbs into that bowl. Sometimes I'll garble them a little bit. That's that fancy herbal word for breaking herbs down a little bit, tearing them apart. So put that all in the bowl and then get yourself a really heavy wool blanket or some sort. I mean, synthetic works great too. You just don't want any air to be released. You're making yourself a little herbal inhalant steamer teepee, basically. So you get the hot water, you pour it in the bowl. If you have some essential oils, great, but they're really not necessary and they can be really intense. You're getting lots of those essential oils just from the plants that you collected, and it's much more affordable to do it this way. So pour the hot water into the bowl, cover yourself with this really heavy blanket, and just try to, enclose yourself in this steam room, essentially, and just breathe. Just take deep, deep breaths in and out. And if you have a lot of thickness and gunk built up in the respiratory tract, you'll find that you're just starting to cough it up, and you just use that bowl as a receptacle for all the nasty stuff that's coming out of you. And do it a couple times a day, and you will find so much relief. I love an herbal inhalant. So important.
Yep. And they really help encourage deep breathing properly.
Where you live is a huge factor for your lung health. So Jenn lives on the East Coast. She's got all that humidity. That's actually can be great for lung health in some ways, but for some folks, it can really exacerbate maybe a precondition where you're born. We're all born with different constitutions, right? Or doshas, call them what you will. If you already have a moist constitution and you live somewhere that's really humid, you're going to be taking some drying herbs like pleurisy and yarrow and drinking those daily to just kind of get dry yourself out a little bit. Whereas if you're on the West Coast and you're in this kind of dry desert environment, you're going to want more of those mucilaginous herbs because it's just so drying here and you probably are experiencing more irritation. So consider your environment too. It's not just about like your acute symptoms and acute illnesses. It's also about general maintenance with the lungs because they are this really important system that we need to give more attention to. Cool. All right. Well, moving on. What do we do for shortness of breath?
Let's see. All right. So like you were talking about in the last question, consider your environment. Well, what's contributing to the shortness of breath? Is it like some kind of a form of acute stress that's almost making you, panic? Is your heart rate, fluctuating, like starting to flutter or slowing down? And is it more of a chronic lung issue? So you consider what Colleen was just talking about. And also, for maintenance, you want to look at relaxation techniques, practicing your deep breathing. You certainly want to support your nervous system, like with the brain and nervous formula, your adrenals, that autonomic component needs extra support. So you can always, work with our lung formulas, especially to help that, more chronic issue or the more acute thing. But you need to definitely get in the practice of, working with your breathing techniques and supporting other areas that could be potentially weak and contributing to that. Obviously we have to expel that mucus, thin it out, help the body eliminate, move your lymph, and also your immune system. You got to make sure you're supporting that
big time,
and really helping your body adapt to those stress responses. And, don't overdo it. Yep, keep it simple. You don't need to, take 15 formulas. You just keep it simple and keep an alkaline diet. Don't take anything mucus forming like dairy or acidic.
Totally.
That's not good. That's just going to compound the problem. You're going to keep piling acid on acid. You need to clean it out. So for shortness of breath, the herbal inhalant would be great. Really assess if your sinuses are super clogged too. You have any congestion in the throat. Same with the lungs, but really work on stress, immune support, and get some deep breathing. Do some yoga, do some meditation, or if you just have to, get away from that noisy, overstimulating environment for a little bit.
Yeah.
And and chill.
Yeah, I agree
Absolutely.
that a lot of shortness of breath can be attributed to that chronic fight or flight, where you're kind of in that chronic state of always watching your back. Every little thing is triggering a stress response, potential panic. So I totally agree with Jen. We have Spasm Calm, which is one of my favorite formulas to recommend in shortness of breath scenarios, strong fight or flight response scenarios, potential adrenal fatigue. It's got a lot of calming herbs in it, and it also has lobelia in it. And so that brings me to talking about bronchodilators. So they are what they sound like. So you've got the bronchial branches that are going into the lungs. It's what's really cool about the lungs is they look like a root system, like tree roots. And so I'm sure you've seen the images that of the lungs where they flip them and just make it look like this beautiful tree. And they really are. They're our oxygenators, and our carbon dioxide. They are doing essentially the same thing that trees do. So you've got these bronchioles, and they get contracted during kind of an acute shortness of breath scenario. And you can take herbs that are going to dilate those, that are going to open up those bronchial passageways. And lobelia is like one of my favorites. It's used for acute panic, and it's used for acute shortness of breath. And we can't, of course, use other more disease state terminology there, but you can imagine what we're talking about here. And so lobelia is a low dose herb, though. It's in Spasm Calm in a low dose. So you could just try Spasm Calm if you're having an acute bout of shortness of breath. But you can also try lobelia on its own, and it's an emetic in high doses, so it will make you throw up. So to determine your dose of lobelia, you do 1 drop at a time for a short period of time, 1 drop every 5 minutes or so, until you get to a drop dose that makes you feel like you're starting to get nauseous. And then your dose would be 1 drop less than that. So if you get to 5 drops and you start to feel nauseous, then your dose of lobelia is 4 drops. And so this can be really helpful for folks that have those acute, really scary shortness of breath situations. You can also carry around peppermint and eucalyptus essential oils during those moments. Those are also bronchodilating. So yeah, have your herbal allies on hand when you're dealing with stuff like that, because it's really serious. So yeah, without disease state speak, how do you release the sinuses? How do you open them up? Then there's the conversation about what's the difference between a mucolytic herb and an expectorant herb. So we want both in that scenario, because sometimes your expectorant herbs aren't going to work so well because things are so plugged up that, maybe you're trying to get things out, but it's not coming. So first you have to loosen up any stuck sinus gunk. You want to loosen it up with a mucolytic first. So that's something really warming. So try our fire cider. That's a really good one. It's super, super hot. Yeah. It's made with a bunch of onions and peppers and garlic, and it's a great mucolytic. So when you eat a spicy meal and your nose just starts running, it's because it's loosening and liquefying some of that. It's essentially liquefying that stuck gunk in your sinuses. Then you use the expectorant, which is all about the moistening herbs, right? So it's really kind of helping to liquefy and thicken and release. So that's the expectorant. It also, so that's kind of the difference between mucolytics and expectorants. You've got fire cider for your mucolytics. You've got yerba santa and thyme, which are both in lung detox, versus expectorants. You've got marshmallow, you've got L-campaign, you've got mullein. So and fenugreek. So fenugreek and mullein are both in the 3 lung tea, and L-campaign is in lung detox. So the combination of those 2 formulas, again, is going to be great for releasing the sinuses.
Okay, awesome. And I know, again, like herbal inhalants, that can definitely help.
Yeah.
Neti pots. We're going to get into a craniosacral release. It's not like what you would normally have done professionally necessarily, but it's a good way to, open up, like gua sha, using the gua sha tool, but to massage the sinuses, especially up in through here, the top of the eyes, behind the ears as well, and, that little pocket. Massaging all of that and along the jawline also will help. So we'll get into a little bit of that, but that's also some good ways to just manually release the sinuses. I know neti pot doesn't always do it for everyone. That's where the herbal inhalant, especially repetitively, along with the herbs you were talking about.
Yeah.
Really, sometimes it takes a little while to get that head to budge, but it can happen. And yeah, just keep your alkaline diet. I mean, really, again, don't add more mucus into your routine.
Right. I mean, diet's so huge when we're talking detox. Oh, lung month isn't exactly a huge detox conversation, even though it is an eliminatory organ. But I think, we're just hoping that you all are still practicing all of your great dietary detox foods. And if you want more information on that, there's tons of information on our website, drmorses.com, as well as if you go back and watch any of our podcast recordings on our YouTube channel, you can definitely learn more about the detox diet. So of course, with Dr. Morse's herbs, it's all about the formulas and pairing the formulas. And so let's talk about which formulas are best to strengthen the lungs, especially with lingering respiratory irritation and damage, or with nodules, soothing chronic and acute respiratory spasms. So this is a long-winded question. We've got a couple of different directions we can go here, but there's definitely protocols that include not only our lung formulas, but a lot of Dr. Morse's other detox formulas.
I mean, nodules, that comes up a lot. And it's a scary word for a lot of people, but it's a very, very general term used by the medical community. It's in a general sense, it's a growth of an abnormal tissue. But it could show up anywhere. It could be under the skin. It could be on any organ, tissue, or gland. It can just be fluid, benign. Most of the time, there really aren't. But you know what? Regardless, if you get something like that showing up, or someone tells you, even if a lot of times the doctor will just say, okay, we're not going to worry about it right now. Well, no. That's your body showing you signs. You probably had some flags before that. Don't beat yourself up. Let's start addressing it, because that's showing you lymph is backing up, waste is backing up, your body isn't quite eliminating where it needs to be. Those are a collection of weakened cells and, gradually going to be weakened tissues. You got to start taking care of it. So, your specific protocol really depends on, the person, what you're dealing with. We all have our unique strengths, our unique weaknesses. And are you pretty frail? Are you depleted, or are you strong and like you are, up for a fast? You could totally, knock that out. Or maybe you need to be built up a little bit. So those are things that you need to evaluate, and, as far as your diet, kind of go along with that too. If you are depleted, I don't recommend, an intense fast at first, but you can certainly include grape juices, watermelon, the lemon, water fast, but still find a good balance for yourself. But the lung detox, the 3-herb tea, the spasm calm, these are very good for, those acute lung spasms and irritations, just to continue working with on a regular basis. Of course, round it out with your kidney and lymphatic herbs too.
Well, you were saying all of that, and then just keep in mind, like Jen was saying, there's a bigger picture going on here with the chronic stuff. And we generally, when we're building out a protocol for a client, we are thinking about that. We're thinking about, okay, so there must be some stagnancy in order for this nodule to have formed in the first place. And so the lymph and the kidney are needing to be moved. So with the herbs that, with the formulas that Jen just talked about, with Spasm Calm, Lung Detox, and 3-herb tea, we're going to be combining those with a kidneys and bladder formula, maybe even 2, and one of our stronger lymph formulas. We're also going to be assessing whether or not there's good absorption through the gut, because if we're not absorbing nutrients properly, nothing's really functioning properly, and our immune system's not getting the nutrients that it needs in order to go and attack that nodule and make it go away. There's just a bigger picture here. You can always reach out to us to get a personalized consult if you are having chronic lung stuff. You can go on our website and book an appointment with either Jen and I to do a face-to-face consult and talk about a specific protocol for you. With the specific herbs, we talked about lobelia. Now, I wouldn't consider this for a long-term, more chronic issue, because lobelia is such a kind of low-dose herb. And so we talked about that earlier. With an acute spasm of the lung, you would want lobelia in your arsenal, and Spasm Calm is a great formula for that. But I did want to call to attention skullcap as well, because we're talking about all these different imbalances of the lungs, and I have like a nervous tick where I just like do a weird cough all the time. And but then also when you get ill, sometimes it's the lung spasming that's what keeps you up at night and makes it hard for you to fall asleep. One of my favorite herbs for that is skullcap. So brain and nervous system has skullcap, and but you can drink skullcap tea. It's in the mint family. It's a antispasmodic again, and or you can get just a single herb extract of skullcap as a tincture, and that is one of my go-tos at night if I'm having a hard time falling asleep because either I have an acute imbalance that's causing me to have that lung spasming, or if I also just like it for sleep. I think skullcap is a really wonderful, subtle, relaxing herb that doesn't have side effects. You don't wake up groggy. You can do it during the day if you're one of those kind of acute fight or flight, acute chronic panic. Skullcap could be a really good kind of calming herb for you throughout the day too. Yeah, because you're kind of in that like spastic state all the time. So which hops and valerian are definitely sedating. So they're going to make you feel tired during the day. Skullcap is that like during the day, so I still can function, but it's kind of helping regulate my nervous system and keep me chill. Hops is contraindicated with depression. I always like to remind people of that. Don't even drink beer if you have depression, because I know that's probably more depressing for people to hear but hops is definitely one to avoid, and so go for Belgian beers because those are mostly cardamom based. And we don't recommend drinking alcohol with Dr. Morse's detox protocols, of course, but it happens. We know everybody cheats. Okay, so we're getting close to the end here. We still have a few questions here. So how long to work with these formulas? People always want to know, can they take them long term? Is this just a short term thing? We're talking lung health, so it's not as big of a deal. These formulas, in my opinion, are pretty safe to take long term, especially if you've got chronic lung stuff going on. But they're also, especially with Spasm Calm and the lobelia herb that's in there, I would definitely take breaks from that one. But yeah, Jen, what do you think about that question?
Yeah, I mean, I think, a few months, because I like to work, I think I've told you before, I like to do something for 3 months, up to 6 months, really give yourself some time to deeply cleanse, especially with the seasons, and, take breaks, have a maintenance protocol, like the stuff you can take daily, like maybe lung detox, kidney and bladder daily, lymph daily, endocrine daily. Those formulas are great for maintenance, or you customize it a little bit based on, your own chronic needs. Or in your health goals, really. But, if you can go a little more intense for 3 months, take a break for just as many, go back again, but still keeping a really, clean diet the entire time, you're definitely going to see progress throughout. So the more chronic the issue, the longer you're going to want to go. But, it's just going to be off and on, pulsing the herbs periodically. But the acute, depending on the severity, can go a little more aggressive.
Always.
But it depends on the person. Yeah.
Great. Yeah. So good luck using all these tips in your own health and working with your family and friends. We definitely encourage you to try some of these formulas out and enjoy them.
Okay, so now we're going to talk about a little technique you can do here at home, craniosacral therapy, or we're just going to do a craniosacral release just to open the sinuses, the area of the ears and the head. It's just a very, very simple thing. Colleen's going to show you in a moment. You can still get it professionally done, which if you want it, a lot more involved. But this is what you can do at home before and after, let's say, your herbal inhalant. If you're going to go get it professionally done, if you have blood clots or a history of seizures, they're probably not going to, do this procedure. So, keep this in mind, but we're really focusing on just a sinus release. So you're going to want to lay down to help the body relax. You just begin with slow, deep breaths for a good minute or so. And then when you do go through the motions, you just want light, gentle pressure. You don't want to go too intensely. You don't want to make yourself see stars or anything, and just repeat it every day or as often as you need to, but definitely before and after you do an herbal inhalant. And Colleen, do you want to demonstrate, since you don't have glasses?
Okay. All right. So we're going to do this craniosacral meditation. So if you can please find a place. I mean, some of you are probably listening to this podcast while driving a car, so we do not recommend closing your eyes. But if you do happen to be sitting somewhere where you can lie down or sit down, please do so and close your eyes and start to take a few deep breaths. Just start envisioning how the breath is so powerful as you're breathing in that oxygen That oxygen is entering and filling up your lungs and then going past that little layer and lining of epithelial cells and into the blood. And your blood is then carrying that oxygen throughout the body to oxygenate every single cell inside of you. And then you are, on your out breath, releasing toxins, releasing moisture from your body and reintroducing it to the general water of the planet. Remember that this planet, it's all a recycling system. Think about your part in that, how there is no water added or removed from this earth, and that every breath you breathe brings more moisture in and releases more moisture out to be added to that cycle. And then you're going to start to find those craniosacral points. You're going to take your 3 fingers, your pointer, middle, and ring finger, and you're going to place them at the line in the middle of your forehead, going vertically. So they're going to be kind of fingernails touching vertically on the middle of the forehead, and then you're going to gently massage away from the middle of your forehead towards your ears. And that is the first craniosacral position. So spend some time there, taking some deep breaths, feeling the lymph being pushed. You definitely don't want to push, like Jen said, too hard that you're feeling stars, but this is going to help to release some of that locked up gunk in the sinuses and just general healthy flow of lymph, bringing more circulation to this area of the body. So that's position 1. And you can, of course, repeat this meditation on your own time, doing these movements for as long as you feel necessary. The second position is right underneath my headphones. You're going to take your hands kind of like the Star Trek hands, and you're going to put them on the front and back of your ears and just kind of slowly draw down gently here on the front and back of your ear. That's position 2. So you've got your pinky finger and your ring finger in the front of your ear, and then behind your ear you've got your middle finger and your pointer finger, for those of you who are not getting a visual right now. Don't forget your deep breaths. And then the final position is you're going to take your 2 thumbs and find the ridge in your eye right below your eyebrow. You might actually be able to feel a little pocket in there. This is the third position. You can even make little heart hands if you want. It's where you're making your hands into a heart. And then you're going to just gently press here. Not hard, so that you see circles or stars, but just a gentle press here can really help to relieve some of that sinus pressure. And so my sinuses are open, so this is just good for general maintenance and moving lymph, keeping things flowing, bringing circulation to the area. As you're moving this lymph, you might feel a little bit of a cough or some mucus moving in your throat. That's all good. And at that point, once you've done those 3 positions, you've completed this exercise, you can take a few more deep breaths in and out until you return to consciousness and bring your awareness back into your body. Wiggle your fingers and toes and thank your lungs for all the hard work they do to keep oxygen in your blood and regulate that kind of fluidity in the body, that connection between the lungs and the kidneys. And you can open your eyes. Well, we hate to say goodbye, but that's it for today.
Yep, that's awesome. Yep. Thank you all very much for joining us, especially on our first Detox Talks. But we're just going to make this a lot more fun with every podcast coming. So thank you all for joining us and on the webinars. We look forward to seeing you all and, ask questions. That's what this podcast is
right. The more questions you ask, the more kind of ammunition we have for these really informative podcasts moving forward. Definitely join our webinar at the end of the month, the Respiratory System, where we'll do the deep dive, and also feel free to book a consult with Jen or me. We would love to meet you and talk to you about your personal health goals. And don't forget, next month, join us for our podcast on bone and joint health. So thank you so much for joining us.
Yeah.
I'm Colleen Bingham.
Thanks, everyone. Yep. And I'm Jen
Have a beautiful
Billingham.
day.
Have a wonderful day.